You're listening to the We Are Libertarians podcast network. Find all of our shows at wearelibertarians.com.
Episode 153, The Paradox.
Welcome to The Paradox with your attending, Dr. Eric Larson. He is a practicing anesthesiologist and clinical assistant professor at Michigan State University College of Human Medicine. Listen in as he takes you behind the scenes of what practicing medicine in today's ever-changing world is like with another doctor. The Paradox is a fun and accidentally informative show for physicians, patients, or anyone who has ever found themselves in a waiting room.
Welcome to The Paradox. I'm your host, Dr. Eric Larson. Thank you for joining me as we explore the U.S. medical system in a fun and informative format through expert analysis. And today's expert is Andy Schoonover. He's the CEO of Crowd Health. And we're going to talk about his innovative and really disruptive means of providing health insurance, or I should say really say health care, because it's not an insurance program. I think it's probably more closely aligned to a health sharing ministry, but it operates differently and sort of like a GoFundMe. I think you'll find it really interesting. It might be something that you're interested in personally actually signing up for. So enjoy the episode. I think it's going to be something that will be, again, another disruptive, innovative thing within the healthcare space, people providing care in ways that are saving money, utilizing markets, and providing solutions where we're looking for legislative solutions. They just never really happen, right? But this is one that goes outside the regulations and still can find ways of saving you money and providing probably better care in many respects than the traditional model of using health insurance. Welcome to all the new listeners from the We Are Libertarian Network. I'm excited to join the network, and thank you for stopping by. I hope you enjoyed the show where we describe basically things in the U.S. healthcare system. We describe people finding solutions, problems, and sometimes we don't have solutions. And anything that's going on in medicine, which I don't know, maybe a pandemic. So we'll be talking about that from time to time as well. In fact, next episode is going to be another discussion with the immunologist who's an expert on COVID. If you've not already, be sure you sign up, subscribe to the show at The Paradox. You can go to find the show notes for today's show at theparadox.com/153, or you can just visit the page in general, which is at theparadox.com. That's Paradocs. Finally, if you like what I'm doing and want to keep the show going, please go to the Patreon page at patreon.com/theparadox, spelled the same way. There you can have a small monthly pledge and just help keep the show on the air. And it's a great way to express your support for not only me as a creator of this show, but also people who are creating content that you find worthwhile and want to support. But without further ado, Crowd Health is GoFundMe for healthcare on Nitro with Andy Schoonover. Enjoy. Well, I'm here with my new friend, Andy Schoonover. He's the CEO of Crowd Health. And today we're going to be talking about yet another innovative way and someone who's being disruptive in the healthcare system. So Andy, thanks so much for joining the show.
Thanks for having me. Appreciate it.
Well, why don't you, I guess, start with the story. That's, the standard story. What is the impetus of your company, the Crowd Health? Because when I heard your story the first time, I thought, well, this is new, but it's sort of a story we've kind of heard. But why don't you go into sort of why you started and what it is?
Yeah, sure. So I was rolling off a previous employer. I was the CEO of a healthcare technology company. We were doing remote patient monitoring for folks with chronic conditions. So we had blood pressure cuffs and weight scales and pulse oximeters and things like that in the homes of elderly with chronic conditions, monitoring that information. Sold that company, rolled off it. And as many folks, once you roll off your employer's health insurance plan, you have to go to healthcare.gov. So off I went to healthcare.gov, got a plan for me, my wife, and my two girls, $1,200 a month. And it worked great until I actually had to use it. So my little one was having recurring ear infections. And so we went to the ear, nose, and throat doc who looked at her ears, perforated eardrum. She needed to get tubes in her ears. And so it's, parents are listening, many of which I'm sure have had the same situation. So off we went to the local hospital, 15-minute procedure. I think we're in the hospital for a total of 45 minutes. And got the bill, and it was $8,000. And I'm like, wow, $8,000 for 15 minutes. I think we'd all love that hourly rate. And so
I would too.
Yeah. And
just to be clear.
So I was like, okay, well, I got health insurance. This is what health insurance is for, right? I get a nice note, snail mail, interestingly, about 30 days later that said it was medically unnecessary. And I, went through 2 rounds of conflict resolution. They still wouldn't pay for the surgery.
Wow.
And so I called them and I said, I quit because if you're not going to help me when I need help, then I'm not going to pay you $1,200 a month. And since then, me and my family, my 2 girls, we've been uninsured. We have figured out a way to work outside of traditional health insurance, the traditional health insurance system, and started building some tools. And the culmination of that was Crowd Health. I said, okay, if our family can do this, then I'm sure that other families throughout the country would be interested in doing this, especially since we as a family saved about $10,000 a year by doing it ourselves. And so we raised $6 million back in April, seed capital to start this company, and we're off to the races. So as we're recording this is November, which we're right in the middle of open enrollment season, which is kind of our
Yes.
big season, and we're just seeing an incredible amount of interest in what we're offering.
So lots to unpack there. I mean, I guess the first thing is, when it comes to health insurance and you're faced with deductibles, right? And so I'm actually surprised that it was denied, because rarely are Miraganabe is denied, I thought. But I guess it just depends on whatever the criteria the insurance company sets forth, right? You're captive to whatever they decide, right?
Well, funny
so
thing
is
this, it was so bad that our ENT delayed his vacation by a day because he was worried about her long-term hearing. And so, so my ENT's looking in her ears, seeing a perforated eardrum, and some guy 1,000 miles away in New York City says, no, it's not medically necessary. So it was, as you can imagine, I was pretty pissed off.
Sure. And I can imagine it probably wasn't an ENT surgeon, for one thing, who's reviewing this. And if it is even a physician, and if it was a physician eventually, it probably was, again, not the right specialist who has any idea what they have their algorithms or whatever.
Right.
I feel like it's a lot like life insurance in some sense, right? Like they will try and deny claims, and they always end up paying if you're persistent enough. But then they hope that, 10% of people just give up for whatever, $10,000 or whatever it might be.
Yeah. Well,
and so
I've been fortunate. I was in a position to write $8,000, a check for $8,000. But I think, the thing
Right.
for me in our company is much more missional than money making. It is, 95%, maybe even higher than that percentage of the population can't write an $8,000 check to the local hospital. I mean, that would put them in severe financial distress, and so the whole point of health insurance is if you have a big event that you won't go into financial distress. Right. And so we have all these people going bankrupt. About 250,000 families who had a health insurance last year went bankrupt because of medical expenses. I mean, it's just clear to me that the health insurance system is not working. And so that's what we're kind of out to try to change.
Yeah, no question. Because, if you look at other insurance, for instance, I think, if you have homeowners insurance, no one expects you to write a bill, or, a check for $250,000 or whatever it is to replace your house. I mean, yeah, it may not happen right away, but for the most part, it gets done, I think, pretty efficiently, like you'd expect insurance. But yeah, health insurance is very strange in that sense, how it just works. So my family, you probably don't know this, but my family probably a year and a half ago, through weird circumstances, went also without health insurance for a year because it was, anyway, it's a long story, and then listeners of the show would know this. And I went to health sharing ministry. So, and did that for about 15 months. And then basically through my wife's work, we kind of have to get insurance.
Mm-hmm.
I mean, the group pays for it. And so it makes, it makes financial sense to do it. But why don't you describe, because I think most people on the show are familiar with the sharing ministry, but what you're doing is different, right? And so, the health sharing ministry, to give an example, I had a procedure, I got a bill, I paid the bill, I requested that it be pay in cash, and so I got a cash discount at the time of sale, but it's still, a couple $100, maybe it's $1,000, I can't recall. And then I got reimbursed, I guess you'd call it. You'll get the sharing check in, I don't know, it was a couple months. It took a few months to get it, mainly because I just didn't know what I was doing when I was trying to submit my claim. And so I would have been probably more efficient than that. It worked fine, but I was sort of on the hook for a little while. And so, how is, I guess, explain that, how I guess the ministry works and how yours is maybe the same or different.
Yeah, sure. So, lots of people ask, are we a health sharing ministry when we're not? And we're legally different, operationally different, clinically different. I can go through those if you'd like, but I'll share how ours works. You on a monthly basis are asked to deposit funds. So it's about $150 if you're between the ages of 5 and 54. It'll be $150, and then a $25 is our fee, like our platform fee to get access to the platform. So it's about $175 per month. And if you have a big family, we have big family plans also. But you just put that money into an account. The account is owned by you, so it's your account, and you do that every month. And then if you have a bill or a health event, an injury or an illness that's greater than $500, then we're actually going to crowdfund those funds from the community of people that we have. So I will go to you and I'll say, hey, Andy's daughter had a broken arm, and it's going to be, I'm making up a number, $8,000.
Sure.
And she's going to pay the first 500 of it, but we need 25 more people to pay $300 each to help Andy with his daughter's arm. Will you do that? Yay or nay? And so you actually can vote on that. I mean, you actually say yes or no. I will help Andy's daughter. And you can say no if you like. This is a voluntary thing. This is actually crowdfunding. And if you say yes, then your money from your account will be transferred over to Andy's account. Andy will then have enough money to go out and pay for his daughter's broken arm. If you say no, then you actually have a reputation score within our system. So when you see that Andy is asking for money, you're going to look and you're going to say, okay, when Andy's asking for money, so when people ask Andy for money, does he give? And so you'll see my score. We actually have a buyer score also. So is Andy going to the Mayo Clinic for a flu, right? Or is he going to a surgery center, which is way less expensive? And so you'll look at these two scores and you'll say, oh yeah, Andy's been a really good member of the community because he pays when asked, and he searches for a really good price for his service. And thus far, that kind of law of reciprocity, which we just have as human nature, right, has worked in that people are willing to pay for others because when they have an issue, they want people to pay for theirs. So it truly is a bit of a GoFundMe meets, eBay reputational scores. So it's kind of, the aggregation of some really cool other what other cool companies are doing and applying it to healthcare. So that's how it works. In terms of how you pay, because a lot of people want how do you pay? For the little stuff, which at point of sale, like your OBGYN appointment or your pediatrician appointment or whatever, you will pay for that because those are under $500. If it's a big one, like a knee replacement, we will pre-negotiate a knee replacement with the doctor in a bundled fashion. We will pay them cash on the day of that procedure. And so we will get 30-40% discounts from the orthopedic surgeon in this case for getting cash. And so those are really kind of the benefits of doing this, is getting significant discounts from those folks by paying them cash on the day. I always say doctors love us maybe even more than the patients love us because they want cash as opposed to haggling with health insurance companies.
Yeah. I mean, there's a simplicity of it, I guess, once you have a contract and getting a big lump payment from Blue Cross Blue Shield every month or whatever, but yeah, definitely not having to submit claims and having all that prepaid, I mean, is a tremendous advantage. I mean, obviously if you had enough of that in your business, then you could remove some personnel that you have for billing and things like that. Obviously you need enough people, but to doing that.
Well, yeah. I mean, even through some, the health records or EMR, EHRs, when you're billing, you use them for billing, they will take, 6, 7, 8% of your revenue just by using their billing system. Right. And so if we can pay them in cash, they can save that. They can save the people in the billing department. As you know, doctors have to haggle with health insurance companies around what they can and what they cannot provide for their patient. I've heard it's like 30% of doctors' time is spent, haggling with health insurance companies. And you as docs, just you want to be with the patient, right? Like that's what you love. That's why you got into medicine. Not haggling with some administrator who doesn't have a clue what's going on, from 1,000 miles away.
Yeah, one of the great benefits of being an anesthesiologist, I did not realize when I went into it, is that I don't have to deal with prior authorization. Now, that doesn't mean other people don't,
You're right.
don't have to do that. And I guess I pay for it on the other end in the sense that I may not have surgeries come to me that ordinarily would have because people were dealing with, the insurance companies. So yeah, I mean, this totally sounds like a GoFundMe, and you have a social credit score, I guess, in some way, right? And you have, so the expectation is that people pay a base fee, and then it's sort of like with this health sharing ministry, it was that you have a certain amount that every month, and you end up basically sending that to some person as opposed to sending it to, I think one month you send it to the corporation or the main administrative office, and the rest of the other 11 months you send to some person, like in, Gainesville, Florida or something like that. And so this is different that you're building your own account, and then you just send it to you guys, and then you guys sort of send it to wherever it's needed. So is there like an expectation of how much every month you're going to be asked to give, because I suppose the amount, what's needed every month is going to vary within the organization.
Yeah. You're going to put in the same amount most months into your account. Right. And so it sits there in a bank account owned by you. And then, if you don't use it, then you can take it with you when you leave. So it's literally your money. We're just asking you to put it in a bank account to make sure that it's there, right? We can say, hey, keep it in your own bank account, but we just want to make sure that people aren't spending it on a new car or something, as opposed to, the crowdfunding their fellow community members. So, I mean, there are for sure similarities with the health shares, and the back end economics are kind of the same. You get benefits from paying in cash and things like that. So there are some very valuable things that the health share has done. And, some of these have 400,000 members, and they've been around for 30 plus years. And so it shows that there is a viability in the mechanics of the way that they do it. We've changed up the mechanics a little bit, but the economics are very, very similar.
Yeah, sure. I mean, you have an expectation of how much you pay out, and you have a buffer put in place, right, to make sure you can cover unexpected, whatever that might happen. So the obvious questions are, what are the exemptions for preconditions, right? I had a kidney transplant. Can I join and start, pay for my dialysis and things like that? Yeah.
So there's only two reasons why we would not allow you to join the community. One is smokers. Two is obesity. So if you're over 300 pounds or you've smoked consistently for any 3-month period in any part of your life, that is not something that we're currently accepting. We may in the future, but not currently. And then pre-existing conditions. Yeah, I mean, you can join us if you have a pre-existing condition. We just ask you to pay for your pre-existing condition in the first year. And then in the second year, we will crowdfund up to 25,000 of your pre-existing condition, 50,000 in the third year, and 100,000 for the fourth year and beyond. So it's kind of like, hey, if you have a pre-existing condition, you can't just assume everybody's going to come and pay for you. You got to pay your fair share. And that's your one year. And then, beyond that, then the community will help you pay for it. So, and we've got lots of folks who've come in, who have, pre-existing conditions, and they're like, look, I don't think anything's going to happen to me in the next year. Like, high blood pressure or high cholesterol or things like that, which a large swath of the population has. People are pretty comfortable that, you're not going to die of high cholesterol over the next 12 months.
Right. Well, yeah. And I mean, for instance, I've got a foster son who had a renal transplant. So he's had, kidney transplant. So for him, obviously it's, massive sort of expenses, just his medications alone and getting infusions. And of course he's at risk for admissions, things like that. So then, the other question of course is pharmaceuticals. So, how do you handle medications and things like that? Is that just sort of part of the expense? If suddenly I get prostate cancer and I have to get a chemotherapy, or is that sort of I pay the first 500, then you crowdsource everything after that?
Yeah, you pay for the first 500, we crowdsource the rest. And it's 120 days of your injury or illness will be paid for, will be crowdsourced. So let's just say you you have a knee replacement or whatever, and you have some, and that knee replacement for us, it'll probably be like $22,000. So you're paying the first 500 of that. The crowd funds the 17,000 of that. There's going to be some prescriptions afterward, probably. And so that is included in that health event, that injury health event. So the crowd would source all the rest of that beyond the first 500. So it's a part of that same health event. We do give people access to low cost, prescription drugs. I mean, it's pretty impressive what folks like GoodRx and others have done, where you can get, especially generic drugs that are 70%, 80% sometimes less than what your health plan is paying. And so we allow folks to utilize not GoodRx, but a similar service that's integrated into our backend system.
Yeah, I interviewed the CEO of ScriptGo, which is a subscription-based product. Actually, I don't know if it's out of Austin, but it's out of Texas where we are right now anyway. And same thing, right? You pay a little membership fee and you get all your medications. I think you pay actually a cost of what the wholesale cost is. They basically make the money on your membership was like $120 a year or something like that. And they just mail it to you. When it comes to working with the people to help find stuff that's low cost, right? So most people, when they interact with healthcare, they're not interacting really ever with healthcare. That's the whole point for the most part, right? Outside of seeing your doctor maybe once in a while. But when you're going for a large, expensive procedure, like you mentioned, the total knee, how do you help them navigate things? Because most people wouldn't know what hospital to call and how cash-based services work. I mean, all those sorts of things. I mean, obviously the big things maybe you negotiate, but other things are smaller, like getting an MRI or something like that. What do you guys do to help people, keep costs low within within the group?
So we have a care advocacy team internally. So you are assigned to a care advocate in Crowd Health. So you're going to be talking to the same person every time you call into us. We think that's important. So they get to know you, get to know your story, get to know your healthcare, get to know your favorite doctors. All of those things are really important. And I know that when I called my health insurance plan, I probably talked to a dozen different people in the 12 times that I called in. It's just a big call center, and you have to tell them what happened again and give them all. I mean, it's just a total mess. It's awful customer user experience, right? And so we wanted to solve that. So you have your care advocate. You can contact them directly via our app. So we have an app that you use. And so if you say, hey, I just happened a couple of weeks ago, a woman was on her boat. I'm in Texas. I know it's cold and you're part of the woods probably, but I'm in Texas.
We have boats,
we're still in boats. Fell off her boat and tore her ACL. And so she calls us. I said, I tore my ACL. I think I tore my ACL. I don't know. So we sent her to an orthopedic surgeon in town that we knew was really, really good. And we knew that orthopedic surgeon wanted to give us, a reasonable rate for an ACL tear. Ultimately, I think she tore her ACL and a meniscus and all kinds of stuff up in there. So
they're all
right there. Right. And so she's going into surgery. What is today? Tuesday, tomorrow, Wednesday. And it's going to be about 40% of what the health plan would pay for an ACL tear, because we bundled a price with that doctor, which includes his time, the facility fee, the anesthesiologist, the physical therapy. That the entire thing is bundled together in one package, and where you're paying them on the day of the surgery. So you don't have to wait 60 or 90 days or whatever to get paid from your health insurance plan. And they love that. And so that's the way that worked in this scenario. And that was very much driven internally by a care advocate who's walking along the way. And that care advocate probably talked to that lady 5 or 6 times over the last week, just in terms of you got the MRI. How did it look? What did they say? Okay, you definitely need surgery. Okay, here's where we'll go. So it's healthcare is just so lonely. Like, people just don't know how to navigate it. And so you just need somebody who's really understand it to walk along the way. And while, this woman tore her ACL, she's ecstatic by the fact that somebody's actually helping her, work through this. So that's a big part of what we do.
I was going to say, so like when my foster son had his kidney transplant, he came to us, and within a few months he had his transplant. It was, my wife's a pediatrician, so it was very easy for her to sort of, in parallel, have about 4 different visits all sort of scheduled and working together. Mm-hmm. Most people, encounter healthcare, and it's a progression, right? And it takes a long time. You go here, and then, now you get to schedule with this person. It's going to be a couple weeks or something. And so, having someone who just knows the sort of what needs to be done makes it a lot easier to get through this stuff.
And not only that, where to do it. Like, as you know,
yeah, right, sure.
You know, an MRI in a hospital system, you know, within the walls of a hospital is massively more expensive than, you know, outside of the hospital. And so if we can keep you from going to those really expensive sources of healthcare, that saves our entire community money, right? And so that's the primary way that we keep costs down and can actually provide, you know, healthcare for 50% of what, you know, the healthcare.gov plans do, and without the massive deductible. So that's a huge component of what we do. So the expense of that is totally worth it.
Sure. Well, and we all know the magnets are better in the hospitals than outside the hospitals,
sure.
But probably
like 6 or 7 times more effective.
Yeah, exactly. There were thousands more of those. It's an extra, like half Tesla or whatever they have in their magnet. Yeah. And so do you find it difficult when you're negotiating? Because when you're trying to negotiate these bundle fees, most places, you know, if you call up most hospital systems, they don't have a bundle price. They couldn't really give you one. You know, maybe they provide, I guess I don't know on the back end if they provide it for their insurance carriers. Usually it's like, this is what it's going to cost for the stay, but you know, we don't know how much physical therapy is, blah, blah, blah. Do you just find yourself moving to independent centers and non-hospital affiliated, you know, docs or centers more often for your care, just because it's easier to negotiate those things?
Oftentimes.
Or are you able to do it with hospitals?
Yeah, oftentimes. I mean, we're trying to stay out of hospitals, right? So that the big building hospitals, right? But as you know, like there's just a consolidation of hospitals and the ecosystem in your city, which are driving costs up. And so they are there. It is much more difficult in some places than others. But there's an ecosystem or I would say a group of companies out there they're going and getting these bundled prices and are trying to set up kind of cash pay networks as opposed to big insurance driven networks. And so with few exceptions, we'll be able to find a place that they can go. And people are willing to travel too, interestingly. You know, especially for those, you know, bigger procedures, like if I can get you a knee replacement for $20,000 less and you have to jump on a $500 airplane to do it, and we'll pay for that to get you there. You know, and by the way, oftentimes we'll actually pay them to do that. Right. So would you take, you know, $1,500 and a $500 trip and a $500 hotel room stay? If I can save you $25,000, I mean, like most people will be like, oh yeah, you know, I'll consider that. Right. And so we make it worth their while to actually travel in some cases. If we don't have a local area that would actually, you know, be able to provide the service at a reasonable rate. You know, some of the cardiac stuff, you can't do that, or it's much harder to do that. But some of the, you know, other, you know, non-acute type of situations, you can do that.
Yeah. Well, I would think, especially when it comes to joint replacement, you know, it's elective, so you can do it kind of whenever.
Sure. Yeah,
it's definitely a lot easier. And the price tag's so big that you can have the price savings.
Exactly.
You know, that make it.
I mean, it's weird. I think it's worth spending some time here, right? Because I mean, people ask me all the time, like, why is healthcare costs rising so quickly? Right. And I was like, it's not that complex. It really isn't. I mean, healthcare sounds complex, but the reasons healthcare is rising is not that complex. You have the buyer of healthcare, which is the insurance plan, right? And they are, through the Affordable Care Act, now maximum you know, amount that they can profit on your premium, right? And so you just say I have $1,000 premium, you know, they can only profit 15%, in some cases 20%, but so they can only profit $150. And so on the outside looking in, that sounds great. Like, you don't want, you know, insurance plans gouging us and making a bunch of profit. But the problem with that is the only way to increase profit is to increase your premium. Right. And so there's an incentive for your premium to go up. And so you have the buyers of healthcare with a perverse incentive for your premiums to go up. And then you have these hospital systems, which clearly want the price goes up. And so I was like, it doesn't take a rocket scientist or a doctor to understand that if you have the buyer and the seller both wanting the price to go up, guess what? Prices go up. And it's not that complex. I mean, there's some complexity in that, but, you know, and even if the doctor did, or the insurance plan did want to negotiate, and sometimes they do, I think it's probably more for show than anything, but with the hospital consolidations, they can't really negotiate. I mean, they have very few options within some of these cities. I live in Austin, Texas. We have 2 hospital systems. So you're negotiating against a duopoly, right? And so if you lose one of them, you're going to lose everybody's business in Austin, Texas. And so United Healthcare has no negotiation power, or very little, with St. David's or Ascension Seton in Austin. And that's just kind of the way it works. I kind of laugh. I have more negotiating power against the local hospital than United Healthcare, which is one of the 20th largest companies on the planet. So, that's one of the weird, things about healthcare.
And you say that because you can send your patients, you're out of town, right?
No, I'm saying that as an individual, me as an individual without Crowd Health, I have more negotiating power against the hospital because look, let's talk about these big, huge expenses, right? Like, and that's what people are getting health insurance for in the most times. Like they're worried and fearful about the NICU babies or the leukemias or things like that. And so the hospital has a decision make. They can put Andy Schoonover into bankruptcy because I can't pay the $500,000 cardiac arrest bill or whatever it is. Or they can negotiate with me. And 99 times out of 100, they'll negotiate. And in fact, there's federal law that says if you provide a service without a contract, you have to, in good faith, negotiate what the price of that service is. It's called open contract law, right? And so I, as Andy, if I were to drop dead right here, or not drop dead, but drop and needed 911 and go to the local hospital, I don't have a contract. And so me and the hospital then have to negotiate what that price is. And so then the hospital will negotiate that price with me. And most of the times it's Medicare better. So, that's why I'm saying I have more negotiating power against the hospital than United Healthcare does.
So when people have all this, I mean, one of the most common causes of bankruptcy in the United States is healthcare, is related to healthcare expenses. I think it's actually the number one cause, right?
It's right up there.
Does that occur because people are insured and they just can't meet the deductibles or that are pre-negotiated by their insurance company, and they actually would have been better off not even having insurance because
I think so.
The hospital would have, in good faith, negotiated better?
I think so. Like I said earlier, the whole point of insurance is if you have a big event, you are covered. Like you don't go into financial distress. But the problem we have with health insurance nowadays is that employers oftentimes are masking rising healthcare prices by keeping premiums flat and raising deductibles. And so people are getting into these deductibles where they are $5,000, $6,000, $8,000, $10,000 sometimes. And look, if you don't have $5,000, $6,000, $10,000, $10,000 in your bank account, you don't really have health insurance because that is going to put you in a massive financial hole. And these deductibles keep creeping up. Kaiser Family Foundation keeps, every single year, like you see these deductibles creep up and premiums have started to flatten a little bit, right? But deductibles keep creeping up and it's just a way to mask rising healthcare costs. I think I did a kind of unofficial survey of, 1,000 random people, on one of those survey things online. And it was like 60% of people know what their deductible is. 40% of people don't know what their deductible is. And part of the 60%, I'm telling you, are lying because I've yet talked to a person who have health insurance who know exactly what their deductible is. They're like, I think it might be. And I'm like, guys, this is one of the most important numbers in your life, because if you have a massive health event, that's how much cash is coming out of your bank account. So you really need to understand what that is, and so all these healthcare.gov plans have massive, huge deductibles. And they are really putting people into some fierce financial difficulties because they just don't understand it.
Yeah. Well, I'll admit that I'm one of those who doesn't know the exact deductible. I do know that once I meet the deductible, I still am on the hook for 20%.
There you go. So you have to co-pay
for quite a while until you hit max out of pocket costs or whatever.
Co-insure it past a certain level. And then you're like, okay, so then what happens? Right. Like there's a max out of pocket that you probably have, which you may or may not know, which is then a really important number too.
Right. Yeah. That arguably, when I talked to Kevin Casey way back in episode 16, he said that was, that's the number you need to know, the max amount of pocket, because that's really what you have to have, laying around in case something happens.
Absolutely.
But that doesn't even include the premiums, of course. You have to take your max out of pocket plus your premiums, and that gives you the total cost of the healthcare plan. And And not surprisingly, they always end up about the same. Like, no matter what plan, silver, bronze, platinum, gold, it kind of ends up being about the exact same number, just where the risk, I guess, is on
Exactly.
payment.
And most people know what their premiums are because it comes out of their, bank account every month, but very few people know what their deductible is.
Yeah. Well, and I think it's also very suspicious when you have healthcare systems that also are affiliated with insurance companies. I mean, clearly they can't possibly be working for this against each other, right? It wouldn't make any sense to have a business where, half of you is working to lower the price, the other half's raising the price. So I think and knowing that can happen means that obviously the other insurance companies operate primarily in the same sort of principles, right? So,
and if they're working together, they should be able to lower costs, and that should result in lower premiums, but it's not. So something is going awry there.
So you've been in business now for a couple months. It sounds beginning of this year, right?
Yeah, we started in April. For the first 6 months, we were building technology and building our go-to-market plan and things like that. So we actually started marketing in October 1st. So we've been at it for six weeks. By the end of this month, we'll have about 1,500 customers, which is where we really need to be. And so in December, from everything I understand, is the first 2 weeks of December are pretty crazy with open enrollment because everybody, just human nature, waits until the very last minute to figure out their health insurance needs. And given that we are an alternative to that, that's when we'll really fire up too. So it's going to be an exciting month or so.
So scalability, what do you see as the maximum amount of people you can have within your I don't know, is it a group? Is it, I don't know how to refer to your
community.
Members,
Maybe it's called a community.
Community. Yeah. Community. That's a good word. So, how many, what's the maximum scale, or it sounds like 1,500 your minimum, right? That's your floor. You have to have at least 1,500 to sort of make things work. Mm-hmm. And then I guess, who are the typical people going to your True Group? Are they employers who say, you know what, we're going to pay some of this stuff, and that way, because we can't afford the premiums, or I guess who you're marketing to in general? Yeah.
So, we're marketing to individuals. And so most of these folks are 1099s. They're gig workers. About a third of our client base thus far are real estate agents. Because they are all 1099s. They don't get insurance from their agency. So we've made a big push there. Lyft drivers, Uber drivers, again, the folks you'll find on Upwork and all those types of groups, right? They're freelancers who are looking for, alternatives. So that's one group of folks. Another is you may be employed in a small business that doesn't have health insurance, doesn't provide you health insurance. So, you start having, some pretty significant regulatory things will happen when you hit 50 employees. You're considered a large employer or something like that. And so, ACA requires you to have health insurance or provide your employees with health insurance. If you're under 50, then there's no requirement. So there's a lot of small businesses out there that would love to provide people health insurance, but just can't. And so those employees have to go and figure out, health insurance for themselves. So we're seeing a lot of them folks as well. I would say, interestingly, 50% of our people who join are coming from being uninsured. So, we are providing folks who have previously been uninsured with an opportunity to pay for their healthcare costs in a little more effective way than going to traditional health insurance. So that's a pretty cool fact.
And then I guess the cost would not be paid for by the community, but do you find that you encourage people to go to DPC or alternative?
Oh yeah, absolutely. Yeah. We would love DPC. We love that model. We're trying to figure out a way to incorporate DPC into what we do. We're trying to figure out if of the 150, a big chunk of that can be used for DPC. So we're just waiting on to just kind of see how the costs of the model is working out. But I do think DPC is going to play a pretty big role in what we do going forward. So I love that model. Any cash pay model for healthcare, we are all about, like, whether it be GoodRx for prescriptions or DPC for your primary care. We love that.
Yeah. It certainly seems like they're the ones who are really good, at least in the local community, which they're going to have better local knowledge than most people and most, a national company at finding discounted places to get, laboratory work or imaging. And
doing lots of
that.
virtual care too. So we provide free virtual care, unlimited free virtual care to all of our members. So, we try to get them their first stop to be, the virtual care, as opposed to going to, other more expensive places. And most people want to take, prefer that anyway. They want to talk to a doc in the comfort of their own home as opposed to sitting in a waiting room somewhere. So we're utilizing virtual telehealth visits pretty effectively.
How many docs do you have employed, and do you have to get them licensed for every state? So
we use a third party.
Oh, third party. So you use a third party person who's already taking care of it for you. Okay.
Yeah, we don't have the scale at this point to do that.
Yeah. Okay. And again, I assume you're going to be looking to cover the entire country.
Yeah, we're all 50 states. I think we currently have people in 46 states. So we're all over, and there is really no limit to where we can go. I think, eventually we'll probably have some, interesting regulatory battles in some states that don't like, alternative to health insurance. And so we will approach those when we get there. I mean, we've spent lots of money on regulatory attorneys to ensure that we don't cross over to that insurance or business of insurance line. And that's why we're doing some of the things that we're doing, like you have your own account and you can take the money with you. It's like, it is your money. It is not our money. We never even touch your money. We're just a platform to help you connect you with other people who want to help. Right. So we think there'll probably be some regulatory, stuff that we'll have to deal with, but what in healthcare is not regulatory, filled or complex, right? Just adds to the complexity of healthcare.
Yeah. I'm always stunned actually, all the people I talk to who, despite all the regulations, despite all the barriers that are put in place by bureaucrats and legislators, are finding solutions to problems that are real. And I think by harnessing technology, you're able to do things that you weren't able to do 10, 15 years ago. When we were first trying to approach a lot of these problems with cost in healthcare, heck, probably even if you look back at 2010 when they ACA, even then it's hard to imagine, but smartphones were not ubiquitous.
Sure.
Right. And so you had to have big legislative solutions, or that was perceived to be the only way to solve a lot of these problems. And it seems like these are much more practical, scalable, and you can have 1,000 of these solutions that I'm sure crowd health is not the right solution for lots of people.
Yeah,
but it's going to be a solution for many.
Right. Well, and the code is all 20, 30, 40, 50 years old too. What I'm saying is the kind of the legal regulatory code is all old, and it needs to be modernized, and so I think the question is, will the big health insurance plans who are benefiting from this legacy code, legal code, who've got lots of money and lots of lobbying money to spend, do they keep it old school, or do they allow folks like us, the legislative, groups allow folks like us to actually innovate? And like I've said over and over here, like, this is missional for us. We see the middle class just getting hammered. The rich people can pay for it. The poor people are getting paid for by government, and the middle class, that middle, 60 or 70%, haven't gotten a real pay raise in 3 decades, because of rising health insurance costs. Right. So I'm trying to go to legislators. Look, if you're really, concerned about, income inequality, let's look at health insurance, because that is the biggest tax on the middle class, and so let me do something innovative to help those folks with their health insurance costs. That should be neither a Republican or a Democrat issue. Let's provide something so people can reduce their healthcare expenses. Seems to make sense. And it doesn't pull off of the federal budget either. And is budget net neutral.
Right. Right. And to be clear, you're not half of the money that you send to Crowd Health goes to lobbying efforts.
Nothing. Right? we have not spent a dollar on lobbying. So, I think the health insurance companies and the pharmaceutical companies are like the largest 1 and 2 largest lobbying groups in, federal and state. So they have some money. So we got to really appeal to legislators to say, no, this is a better outcome, a better solution. I think we're at a tipping point where people are so irritated with how health insurance is. I don't know if you know what net promoter scores are, but it's basically, for your audience, it's kind of a measure of would you recommend this service to a friend? And they have net promoter scores of like 10, which means like 1 in 10 people would recommend this service to a friend. The others like Apple and Chick-fil-A and some of these people, they're like at like 70 or 80, right? And these health insurance plans are 10. So, I think we're at a tipping point where people are so fired up by, health insurance that there might be an opportunity here to really create an alternative. And that would be hugely beneficial for this country from my perspective.
Yeah, I totally agree. And when you're less popular than Congress, you've got some real problems.
No kidding.
Right. And so it's not surprising, actually, that the legacy ones that you have no choice, right? There's no alternative. There's no second Congress you can vote in, right? It's just one Congress. And you pretty much for a long time have been forced to, until you hit Medicare, which is, another can of worms. You've been sort of forced with this sort of model. And it's not one that is not designed to benefit the patient.
Yeah.
And, arguably, if you're a physician, you probably feel like it's not even there to help you anymore. And maybe at one time it was more beneficial.
Well, you have all these docs burning out too. I mean, you're a doc, and you've probably seen it. Like they're burning out. And the number one cited reason is administrative stuff related to health insurance, right? It's like the number one cited reason. So, I think we're at a point. Gallup did a poll back in 2019. It's a couple years old, but it's like the 10 most hated industries. Number 1 is federal government. Number 2 is health insurance. So it's right behind the federal government.
Yeah, they're hand in hand. And but to your point, I do think it's real. It is. We are at not only a tipping point, but financially, you look at it when you can cut costs so significantly, it becomes inevitable, right? Like once taxi cabs, you could find an alternative that was 10% of the cost of a cab ride.
Mm-hmm.
No matter what sort of legislation people put in the way, it doesn't matter, because at that point, people are going to select the thing that is so profoundly, life-changing as far as from an economic standpoint. And I feel like healthcare is kind of at that point now too, where you have the means now of harnessing markets and, innovation, which you couldn't do before you had smartphones, internet, and things like that. So I do think that just they're going to try and stop you as much as they can, because that is their business model. I mean, lobbying, that is primarily how they make their money, right? But I feel like at some point, it just, people won't care about them, and there'll be too much pressure to not do it. Much like taking away people's schools with school choice. They're going to go, or like homeschoolers. I always feel like they're the people who, they might only be 10, 15% of the population, but they'll burn the capital down to the ground if you try and take it away from it at this point. There are too many of them, and it's too life-changing. And so I think the same thing kind of happens at this point. With
Absolutely.
This sort of thing. Well, to find more about Crowd Health, it looks like you go to joincrowdhealth.com.
You got it.
Where else can people follow what you guys are up to, what you're doing? I found you on LinkedIn, but I'm sure there are other places where people can find out what's going on.
Yeah, I mean, we're all the big social media platforms. So it's Join Crowd Health is our kind of name, and all the big ones. So Twitter, Instagram, Facebook, we're all over. LinkedIn, you can feel free to follow me or Crowd Health on LinkedIn. And I'm pretty good at railing against the healthcare space generally in all of our social media platforms. So if you're interested in healthcare and policy and things like that, it's some pretty entertaining stuff that we put up on our social media. You can tell by our social media presence, we are not a health insurance company. We are atypical.
So I have to admit, I don't TikTok. I don't understand it. I also don't understand Instagram. You got to tell me, what does Crowd Health do on Instagram? Because I always thought it was just like pictures. So
yeah. So right now we're going through
what you guys are doing
as we speak. We're going through the top 10 reasons why to ditch health insurance. So I think we're on number 5 today. So we're counting them down. And they're all pretty
was that the gobbledygook? I saw that somewhere.
Was today, and I loved it. I thought it was the best one. But it's to tell your readers, your listeners, it's a one sentence that I think is like 80 words or something crazy like that. Not 80 characters, 80 words, one sentence out of the member guideline of a Blue Cross Blue Shield plan, and you have to be a healthcare economist to understand it. And it's just, I think it's hilarious that, people are expected to understand what goes on behind the scenes of healthcare. I say it's the one industry or the one thing that I buy that makes me feel dumb, and I've had very smart friends who say the same thing, and that's where something has gone terribly wrong when we have no idea how something so important in our lives works behind the scenes. And so we're trying to change that.
Well, thanks so much. And the 80-word sentence sounds like how my wife always criticizes my writing of long run-on sentences.
Run-on, for sure.
It definitely hits home. Well, Andy Schoonover from Crowd Health, thanks so much for joining the Paradox.
Thanks for having me.
Thanks for listening to The Paradox. If you like what the doc is doing, please subscribe and leave a review on iTunes or Stitcher. And share the show with your friends. Become a supporting listener to get access to special bonuses at patreon.com/The Paradox. Show notes can be found at theparadox.com.